Hi, it's Dr. Vinod, and today we're going to go over some untold truths about practice management success in physical therapy private practice. I get asked this question a lot fairly commonly by patients, but also my staff and colleagues about what are some of the key things that make a physical therapy practice successful. And physical therapy practice doesn't instantly mean the clinical practice. It doesn't also instantly mean the business of physical therapy either, because physical therapy practice ultimately falls under the scope of business. Wherever you work, either it be a hospital or a small clinic, it is ultimately a place where you as a provider, as a therapist, work under the scope of a business sort of model. And every business model is very different. So in my experience, there are some common things that have always been tried and true for being successful in a physical therapy practice. And this can go for other medical practices as well. And oftentimes it starts off with just simply understanding what really drives a physical therapy practice to be successful. And frankly, there's a number of things that do, and we could throw them all out in the air, but I'm going to give you 3 things today that I have found that really have driven success at the rehab practice level. So let's get started. The first one, I recommend to give the patient a progress note for the physician to drop off to the doctor's office. I'll give you a quick story about this. I had a patient at one point that I was seeing, and this patient was very particularly referred to me by a physician that told that patient to come see me directly. And that patient came over to me and they said to me on the first evaluation, they said, look, I was going to go to a facility near my house, but I've driven 35 minutes to come see you because my doctor had recommended that I see you only for the service, which was a huge compliment to me. And the one thing I didn't do there is I should have asked her why, which I'd recommend you do. So I did the evaluation. And I was treating her along the way, and every 3 or 4 sessions, she'd say to me, hey, I want to give my doctor a update on what's going on with the therapy and if I'm doing well. I forgot. I didn't do it. And, that physician called me. He called me up and said, hey, can I speak to you? I sent you Jan Doe to see you. I don't have a report, and I don't know how the patient's doing. And she saw me this morning. Why don't you send the report? What are you doing? Click. Hung up the phone on me. That's it. I called back, frantically called back. He was just so upset with me. I called the office, and at that time, the receptionist picked up the phone, and she's like, wait a minute, I'll get him on the phone. And he picks up the phone, and I said, Dr. Smith, and before I could even go, he goes, are you calling me about the same thing I just talked to you about? And I said, yes. He goes, I already give you my answer. Click. Hung up the phone on me again. And I sent a letter over to the doctor right away. I didn't make anything of it. I just forwarded it over, and I never got a referral from this doctor ever again. And I was really surprised. It took me really by heart. I know it's one experience, and some doctors be very particular. I understand that. But what I look back on it after that happened, and the physician had sent the patient to me specifically out of goodwill, right? He trusted me. He believed in me. And the patient did too. And she asked me 3 times for a report. And the first 2 times I can understand maybe like it was a little too early in the treatment, at least according to what I felt. And minimally the 3rd time, I should have been like, yes, here is the report, and given it to the patient. If I just gave that report to the patient right then and there, that patient would have taken it back to the doctor. I would have never gotten that call and lost that referral. So what I learned from that experience is that if you just get into a habit of sending a physician a correspondence and updating them, it shows that you're professional. It shows that you care about your patient. It shows you care about the physician's experience with the patient. And it shows that you are organized and you have the ability to put together your thoughts on paper and send it over to the physician in a manner that gives them the confidence that you're able to be on your game with the patient and with the physician. And what I think is even more important is that as times go on and physicians have experiences with therapists and they don't talk to their patients, or they have a bad day, or the patient has a setback, that extra vote of confidence and that extra work that you've established with that physician goes a long way. By the way, that patient ended up doing very well in therapy. She got better. She wrote, a review, little success story kind of thing. She came back to see me multiple times, and I know she respected me for my care, and I felt good about it. But I never got a patient referral from that physician ever again. So that's number one. Going on to number two is very simple, and we do it all the time as therapists, but we don't think about it. And that is asking the patient about their experience during their course of their therapy. We have always asked the patient when they walk in the door, "How are you doing today, Mr. Jones?" or "How are you doing?" And the reason for us asking that is twofold. One is we want to assess if the patient is doing better to support what we're going to do in therapy that day. And the second thing is it's just kind of like a fun thing to say to people when you first see them, right? Like a very open invitation to talk, a very friendly communication. It diffuses any issues they may have had coming to the facility, and that's great. And my interest was solely to see how well the patient was doing clinically, but not really ask about the experience. And what is the experience? The experience is not just what the patient experienced clinically. It's the whole facility, the team, the people involved with the practice. What is going on in the office? Did they wait too long? Did they have a good experience at the front desk? These are little things that happen to build up in the patient's mind over days, over time when they work with you. You don't know because you haven't asked. The only thing you do is ask the patient point blank, "How's your experience going so far? You feel like this is everything here is meeting up to what you think is good?" And when you get the bad responses, don't react immediately. Make notes of them and start to look at it, right? And then if you want to take it a step further, take a look at certain things like cancellation rates, take a look at like patients who stop coming, take a look at patients that are coming frequently that reduce the time they're coming. Just pay attention to those things. There's a reason for that. And we don't want to assume that reason is because they just magically got better or that, they had an expiration on their insurance or whatever. We want to assume before that happens that you have all the data in front of you. And the best way of doing that is to ask a question so you can correct it or fix it or get validation that it's right. And that's the second tip. And number three, and the final tip I'm going to give you, is another thing that relates to patient communication. And this is really important. We get into the conversations with our patients about how they're progressing, okay? And a lot of times a question is sent to the patient with the intention to ask them if they're progressing or not. And that's very logical, right? You want to ask your patient, "Hey, how are you doing? Are you doing better? Did those exercises give you help?" It makes a ton of sense. But in terms of building a really strong practice, there are two things you want to ask your questions in the same light. I'm going to say it very differently so you understand it differently, is you want to really check with your patient along the way, I'd say every 3 visits, if they're progressing or regressing, okay? This is a touch point with your patients every so often to show them that you care if they're moving forward or moving backwards. It's very, very important. I'm going to give you an example of both. So if you talk to a patient on their 3rd visit, for example, and you say to them, "Mr. Smith, how are you doing? Are you progressing with the plan that we have set forth for your care?" They might say confidently, yeah, it's been great. Good. Awesome. Once you ask the progressing question, you follow up with saying, "Good. I'm glad you're progressing on A, B, C, and D," and give them a short-term plan of what you want to do to help the progression. And when you do that, you have to follow up in the next 3 or 4 sessions and ask them again. This is very different than asking subjectively how well they're doing. You're actually laying out a progress plan for them every 3 or 4 sessions by asking them a key question of how they feel they're progressing. The contrary to this, or the corollary to this, would be, do you feel like you're regressing? Do you feel like you're not doing as well as you should? And that's a great place to address that issue with them of how they're regressing on something that they want to improve upon. Now, when you bring up the regressing question, sometimes I've had experiences before with a patient be like, "Well, I'd like to A, B, C, and D." And immediately in your mind, you're like, they have unrealistic expectations. But that's where you have to be really clever. If they have an unrealistic expectation, you say, "Hey, look, thank you for the feedback. We're going to address those things. Any particular things we can do now to help you out to improve those things in terms of their clinical regression?" Patients, well, I didn't understand my exercise, the one you gave me yesterday. Which one is that? So you've identified a point that they were not succeeding at and you fixed it and you cover that up, right? Because that regression comment that they made, or that ability to understand where they regressed, you've taken that and flipped it into a progression. And then every so often when you do it 3-4 visits, you can meet back with the patient and say, great, so we went over these points last time and revisit it again. Anything that we can do that's going to be helping you progress, right? How do you feel you're progressing? How do you feel regressing? And they'll tell you point blank, and you address those points along the way. And if you keep them engaged like that with that terminology, and they know that you're interested in their progression and regression, not just their progression. So those are 3 tips. I'll give you another bonus tip here. When patients come to your facility and they see things are organized, it's a really big confidence booster for them. And when I say organized, it's just making sure things are in the place where they should be. And that person looks like they're in the right place. And that person looks like they're dressed for the job. And if you take your ability as a clinical director, or you take your ability as an owner or a therapist in general, and you really put a lot of emphasis on the fact that people will perceive your success, your ability to do things well based on how they could feel things are smooth. And again, I understand you can't control everything. That's just the way it is. But if you can control a lot of these factors and the tidiness of the facility, people do recognize these things. And when they recognize these things, they really do take account to how much effort you're putting in to make it that way. This is Dr. Vinod. Thank you for listening to this. Have a great day.